Tens of millions of older adults in America and in the world are living with diabetes right now and don't know it. And for millions more, the disease has already been progressing slowly for years before a single diagnosis is made. The damage, in many cases, starts long before any blood test confirms what the body has already been trying to communicate. And remarkably, some of the clearest early signals aren't in your blood at all. They're in your feet. Surprisingly, your feet are extraordinarily sensitive indicators of your metabolic and vascular health. They sit at the end of your longest nerve pathways and your most distal blood vessels, which means when something goes wrong systemically, when blood sugar begins silently damaging your body's internal architecture, your feet are often the first place the damage shows up. And when diabetes-related changes to the feet are caught late, the consequences are severe. Lower limb amputations, chronic non-healing ulcers, permanent nerve damage, loss of mobility and independence. These are not rare outcomes. They are devastatingly common in people who missed the early signals. So today, we're going to walk through 5 early warning signs that diabetes may be developing, all of them visible or felt in your feet. I'll explain the exact biological mechanism behind each one, how to distinguish a warning sign from a normal variation, and what to do if you recognize yourself in what I'm describing. Because the difference between catching this early and catching it late is not just medical. It is life-changing. Sign 1. Numbness, tingling, or a gone-to-sleep sensation in your feet. Let's start with the symptom that is, by a significant margin, the most documented early warning sign of diabetes in the feet, and also the one most commonly brushed off as nothing. That sensation of pins and needles, of your foot feeling like it's asleep when it shouldn't be, of a strange buzzing or prickling along your toes or the bottom of your foot. This is peripheral neuropathy beginning to develop. Here's what's happening at the nerve level. Your body's peripheral nerves, the long sensory and motor nerves that travel from your spinal cord all the way down through your legs to your toes, are wrapped in a protective fatty coating called the myelin sheath. This sheath is produced and maintained by specialized cells called Schwann cells. It's what allows nerve signals to travel quickly and accurately. Chronically elevated blood glucose is toxic to this system in multiple converging ways. First, excess glucose enters a biochemical pathway called the polyol pathway, producing a compound called sorbitol that accumulates inside Schwann cells and causes osmotic stress, effectively damaging the cells that maintain myelin. Second, elevated blood sugar triggers the formation of advanced glycation end products, AGEs, which cross-link and stiffen nerve proteins, impairing their function. Third, and critically, hyperglycemia reduces the availability of nitric oxide, a molecule that helps dilate the tiny blood vessels called the vasa nervorum, the vessels that supply the nerves themselves. When those vessels constrict, nerves become ischemic. They're essentially starved of oxygen and nutrients. The result is that nerve conduction slows. The sensory fibers that carry touch, vibration, and temperature signals begin to malfunction. This was well characterized in research published in Diabetes Care, which identified peripheral neuropathy as affecting up to 50% of people with type 2 diabetes, and crucially, noted that it is frequently present at the time of diagnosis, meaning it had been developing silently during the pre-diabetic phase. The pattern to look for is a symmetrical, bilateral sensation beginning in the toes and spreading gradually upward, what clinicians call a stocking distribution. It may feel like mild tingling initially, easily mistaken for sitting in the wrong position. But if you notice it regularly, at rest, in both feet, particularly at night when there's no external explanation, that is not positional. That is a nerve telling you that its blood supply and metabolic environment have been compromised. See your doctor for a fasting glucose, an HbA1c, and a simple neurological examination of your feet. Sign 2. Burning pain, especially at night. Closely related to the numbness we just discussed, but distinct and actually more distressing for many patients, is a burning or painful sensation in the feet. Often described as a feeling of walking on hot coals, electric shocks, or deep aching that intensifies dramatically after dark. This is called painful diabetic peripheral neuropathy, and it's the result of what happens when the small, unmyelinated nerve fibers known as C fibers and A delta fibers begin to degenerate and malfunction. These are the fibers responsible for transmitting pain and temperature signals. Under normal conditions, these fibers only fire when there's actual tissue damage or a harmful stimulus. But when hyperglycemia damages them, they become unstable. They begin generating spontaneous, erratic electrical signals, firing without any external trigger at all. The brain interprets these false signals as pain, burning, or intense sensitivity. In some cases, the feet become so hypersensitive that even the weight of a bedsheet causes discomfort. Research published in the journal Neurology and extensively reviewed in the American Diabetes Association's Standards of Medical Care has confirmed that small fiber neuropathy of this type is frequently an early manifestation of metabolic dysfunction, sometimes appearing before frank diabetes is even diagnosable on standard tests. It is one of the reasons clinicians now test with HbA1c rather than relying solely on fasting glucose. The metabolic damage precedes the diagnostic threshold. What sets this apart from ordinary aches and pains is the neuropathic quality. It burns rather than aches. It worsens at rest and at night rather than improving with elevation. It may be accompanied by an almost paradoxical combination of hypersensitivity in some areas and reduced sensation in others. It doesn't follow a pattern that aligns with overuse or injury. If you have pain in your feet at night that feels burning, electric, or disproportionately intense, and you have any risk factors for diabetes, particularly if you are over 60, carry extra weight, or have a family history, this warrants urgent investigation. Sign 3. Dry, cracked, or unusually rough skin on your feet. This one tends to be dismissed almost universally as a cosmetic issue, or simply a consequence of not moisturizing enough. And while dry skin certainly has other common causes, when it develops specifically on the feet, is persistent, and resists moisturization, it can be an early sign of autonomic neuropathy, a less discussed but medically significant form of diabetic nerve damage. Your skin's moisture and suppleness depend in large part on the function of your sweat glands. Sweat glands in the feet are controlled by the autonomic nervous system, specifically the small, unmyelinated sympathetic nerve fibers that regulate involuntary bodily functions. These fibers, it turns out, are among the earliest casualties of chronic hyperglycemia. When they are damaged, sweat production in the feet is impaired or completely lost, a condition called anhidrosis. Without normal sweating, the skin of the feet loses its hydration. It becomes dry, stiff, and prone to cracking, particularly along the heels and the balls of the feet where mechanical pressure is highest. Those cracks, called fissures, are more than cosmetic. In a person with elevated blood sugar, where immune function is already impaired, a fissure in the skin is an open door for bacterial and fungal infection. Studies examining skin biopsy findings in people with early type 2 diabetes and prediabetes have shown measurable reductions in sweat gland nerve fiber density before patients are even symptomatic, before they report burning, before numbness is detected on clinical exam. The skin is, in some ways, an earlier reporter than the clinical examination. The change to look for is persistent, treatment-resistant dryness and cracking, specifically on the feet. Not the hands, not the elbows, not generalized dry skin, but specifically the feet. If you're applying moisturizer regularly and your heels are still cracked, if the skin on the soles feels rough and tight and abnormally thick, and particularly if this is accompanied by reduced sweating elsewhere on the lower legs, mention it to your doctor. Combined with other metabolic risk factors, it belongs in the workup for early diabetic neuropathy. Sign 4. Cold feet or color changes in your skin. When we talk about diabetes and the feet, most people immediately think of nerve damage. But there is a second, equally critical pathway of damage operating in parallel, and that is vascular damage. Specifically, the progressive injury to the small blood vessels of the feet caused by chronically elevated blood sugar. This is peripheral arterial disease developing at the microvascular level, and its early signs show up in the temperature and color of your feet. Here is what's happening. Glucose is not just toxic to nerves, it's toxic to the endothelium, the delicate single-cell layer that lines the inside of every blood vessel in your body. Elevated glucose promotes the production of reactive oxygen species, triggers inflammatory pathways, reduces the production of nitric oxide, and causes endothelial cells to swell and dysfunction. Over time, the vessel walls thicken, become stiffer, and lose their ability to dilate in response to demand. Blood flow to the tissues of the feet becomes progressively restricted. Early on, before this has progressed to frank arterial stenosis, the impairment in microvascular function presents as persistently cold feet. Not just cold in a cold room, but cold at room temperature, cold at night under the covers, cold even when the rest of the body feels warm. It may also manifest as a pale or slightly mottled appearance to the skin of the feet, a dusky color when the feet are lowered, or a redness when they're elevated. These color changes reflect impaired blood redistribution. A healthy vascular system automatically adjusts blood flow to meet tissue demands. A damaged one cannot. Research published in Diabetologia has documented that microvascular dysfunction, measurable in the feet, can precede the development of frank type 2 diabetes by several years, operating during the pre-diabetic window when intervention is most effective. An ankle brachial index test, skin temperature mapping, and basic vascular assessment can detect early peripheral arterial changes before symptoms become severe. The pattern that warrants attention is feet that are consistently, persistently cold regardless of ambient temperature, combined with any unusual color change that you haven't had before. Particularly if one foot appears different from the other, or if you notice a line on your lower leg, above which skin color is normal, and below which it appears pale or slightly discolored. These are not aging. These are circulation. And circulation in this context needs to be investigated. Sign 5. Slow healing cuts, blisters, or minor wounds. Of all 5 warning signs, this one is perhaps the most clinically serious in terms of what it represents about how far the underlying damage has already progressed. And yet it remains one of the most commonly ignored, because the wound itself often seems so minor. A small blister from a new pair of shoes, a tiny cut from a toenail, a scrape from bumping the foot against something. In a person with normal metabolic function, these heal within a few days. In a person with persistently elevated blood sugar, they may still be open and red 2 or 3 weeks later. And in advanced cases, they become diabetic foot ulcers, the leading cause of non-traumatic lower limb amputation worldwide. The mechanisms behind impaired wound healing and diabetes are multiple and interconnected. Hyperglycemia impairs the function of neutrophils, the immune cells that are the first responders to any wound, responsible for clearing bacteria and debris. It reduces the production of growth factors needed to stimulate new tissue formation. It decreases angiogenesis, the process by which new blood vessels grow into healing tissue to supply oxygen and nutrients. It promotes the formation of advanced glycation end products that make collagen stiff and dysfunctional, preventing the normal remodeling that closes a wound. And because neuropathy reduces sensation, wounds on the feet are often not felt at all until they are already infected. Research published in the journal Wound Repair and Regeneration has shown that impaired neutrophil chemotaxis and defective macrophage function are present even in people with moderately elevated, not dramatically elevated, blood glucose levels. The threshold for immune impairment is lower than many patients expect. The warning sign to recognize here is a wound, cut, blister, or broken area of skin on the foot that takes more than 2 to 3 weeks to close, that shows no signs of progressing toward healing, or that keeps reopening despite your care. If this is your experience, you need both a metabolic evaluation for diabetes and, simultaneously, proper wound management from a clinician who understands diabetic foot care. Do not wait. The common thread running through all 5 of these warning signs is that they represent 2 overlapping systems being damaged simultaneously: your peripheral nerves and your peripheral blood vessels. And that feet, because of their position at the furthest end of both systems, are where the damage announces itself first. Numbness and tingling tells you that sensory nerve fibers are beginning to malfunction. Burning pain tells you that small, pain-conducting fibers have become unstable and erratic. Dry, cracked skin tells you that autonomic nerve fibers controlling sweat glands are compromised. Cold feet and color changes tell you that microvascular blood flow is deteriorating. And slow wound healing tells you that immune function and tissue repair have already been impaired by chronic hyperglycemia. None of these in isolation confirms a diagnosis of diabetes. Please don't panic if you recognize one. But these are signals. They are not nothing. They are not simply aging, and they deserve investigation. Particularly if you are over 60, carry extra weight around the abdomen, have a family history of diabetes, or have been told before that your blood sugar is on the higher end of normal. The earlier elevated blood sugar is identified, the more reversible the damage. Lifestyle changes, dietary modifications, structured physical activity, weight management have robust evidence for reducing HbA1c, restoring some degree of nerve function in early cases, and dramatically reducing the risk of progression. None of those options are available once neuropathy is advanced, ulcers have formed, or circulation has deteriorated beyond a threshold. Your feet are not just the base of your body. They are a diagnostic window. And right now, they may be telling you something important. The question is whether you'll listen. If you recognized any of these signs, speak with your doctor about getting an HbA1c test and a fasting glucose. A diabetic foot examination takes less than 10 minutes and can be genuinely life-changing. Subscribe and share this video with someone you know who might need it.